I've had plenty of others.
I think,
give me your rating. How's he done so
I think
far?
he could have been more transparent. And I think I think you come up against the whole idea of reform. I mean, many politicians run on the reform ticket, and reforming is hard. It's real hard work. So Obama gets to Washington, he's suddenly in this big, huge mess, right? There's this big financial markets mess that needs to be cleaned up and needs to be acted on immediately. You could argue whether the stimulus package was the right way to do it. I'm not 100% for the stimulus package the way it was either. So, but the point is that something needed to be done pretty quickly, right? That was almost everyone agreed with that, except for a few libertarians.
Yeah.
Almost everybody else did, though.
Something got to be done itis is putting our kids into debt.
I'm saying conservative and liberal economists both agree that something needed to be done pretty quickly. But my point is not to argue the stimulus package, but to argue is that, so you come in and you're going to be a reformer, and suddenly he says, oh, you got to do the stimulus package. Well, how about my reform I got to get to? Oh, you got to do this health care package. What about the reform I'm going to get to? Reform sort of gets pushed aside, and that's what happens in reform in every single candidate that's ever run for reform. I mean, look at the number of candidates who have run and say, I'm going to go through that budget and take out every single thing that's,
Every politician says that.
Who's ever done it?
Who's
ever done it?
There's no politician that isn't a fiscal conservative when they're campaigning. It's the way it is.
Right.
To hear Obama talk about how, by removing profit from insurance companies and by finding the waste and fraud in Medicare, because apparently there's a line item. Waste and fraud. All we need to do is get rid of that, and it's going to pay for it. I think that people are starting to wonder, wait a second, you can't promise ice cream cones, unicorns, and rainbows to everybody without figuring out how to pay for it. And when he says this is not going to cost you a dime more in taxes and it's not going to cost a dime more in debt to our kids.
Well, let me say this. This is the interesting thing about healthcare. I think that I think people are right to mistrust someone who says we can eliminate X percentage in waste and you won't have to pay anything for it. I'm pretty sure that's unlikely to happen in that way. But I'm also pretty sure that people who warn that Obama is going to do something to you, the taxpayer, that's going to make you unhappy at the end of this bill is very unlikely. It's not how politics works. I think we all know this. What the Democrats have to pass a health care bill, which they will. They have to pass a health care bill that the majority of Americans in 2010 and in more important for Obama, in 2012, believe works. If they think that health care is a failure, they won't re-elect him in 2012.
But it won't even be implemented until 2013, so he's pretty safe after he passes it, at least one election.
I think you're right, and I think that's part of it. But I think it's also, but still, the Democrats themselves are throwing a lot of their money as far as betting where their future is on this. They're not going to put something out there, at least not intentionally, that they think is going to destroy their party. And if it comes out to be a disaster, which it could be, then it would destroy their party.
Well, there's been a ton of disastrous policy out there, and I'm sure that the intention wasn't to make people unhappy.
That's what I'm saying.
So that's the argument, and as far as cutting from Medicare, I'm sure there's plenty. I'm sure you could find those kinds of savings. But then to argue that I'm going to take those savings so I can put them in another similar public program, that I think is an argument that doesn't make sense to a lot of people.
To talk about it, Medicare is $40 trillion an unfunded mandate for the future. I mean, it's ridiculous. So if you have waste and fraud that can be cut, why not
just
cut it as it is? Because this program is going to run off a cliff.
It is more complicated than that, and you know that.
Yeah.
It's more complicated because unless you do something about the rising medical costs, then you have the same problems in Medicare, in Medicaid, and in every other medical program. So the idea is
before we get too much into one policy area, since we want to talk more Obama, for me the cult of personality of Obama is fascinating. But let's talk numbers on polls. This is a guy who walked in with one of the highest popularity ratings of any president. It was high 60s, and now it's plummeted down towards 50%. And a lot of that, no matter who this guy is, that's going to happen because the myth is always better than the reality. What's caused that huge drop? Why is it that within half a year we've seen his numbers drop so far?
I think the expectations were so high that there had to be a pretty big fall there. more than that, this is just my view. I think that the promise of Obama is better than the policy initiatives of Obama. And when people take a look at healthcare, they get upset. I still think people like Obama. I think that they're more concerned with these huge, and I think reform, but something that actually changes your life in a personal way: healthcare, energy. And also, frankly, the economy is kind of sucky, and usually when that happens,
it's all Bush's fault. Everything is Bush's fault.
For a while, but I think that 6 months is probably where you start having to take responsibility for that stuff. So I think all those factors are part of why his poll numbers have fallen. And I think that Republicans maybe are jumping the gun on this a bit. I mean, we're in a really it's a debate about health care, but that's going to pass one day, and then we're going to have to move on to something else. And if the economy improves, I think Obama's numbers will probably bump up.
Why is he taking such a big hit, popularity-wise?
Well, he's trying to do a lot. He's trying to do a lot, and none of it's easy. And there is no unanimity among, there's no consensus, I should say, among American people what to do about health care. I mean, you see all the polls prior to the health care debate saying, yeah, we think the health care system needs some change. But there was no consensus, and there remains no consensus.
Actually, there is
consensus.
When it comes to Obamacare, people dislike it more now than ever. 52% don't like the public option.
But they don't even know what it is. 52% do not know what the public option is. That I can promise you.
More so now than a half a year ago.
But my point is this, is that it's the fact that we don't have a consensus on that. You take environment, we don't have a consensus on what to do about it. I mean, these are things that need to be formed, and they're difficult to do. I mean, my guess is what will happen is, I promise you the Democrats will pass a health care package, and then we will move on. It's likely, if you look historically, no matter what Obama did or didn't do as soon as he took office, that the economy will be improving next summer. And with the economy improving next summer, and with health care out of the way and less controversial things underway as we near an election, my guess is those numbers will change. That's the way of politics.
Except if we recover without jobs. If we're at 10%, and that's sort of a magic number, people don't like double-digit unemployment. And
you're going the last president with double-digit unemployment.
But Americans are strange. Americans want not only are optimistic, they want to be optimistic. So when you see the things starting to move, people get excited about it, and they're optimistic. I mean, it is in our national character, and it works for politicians of both parties all the time.
But the thing you mentioned, consensus. When are you ever going to get consensus on something like a public? There's an ideological divide in America on issues like that you're never going to get a consensus on, and the people who oppose it are always going to be more animated than the people who are trying to.
I think that's true, but even for those who are for it, if you were to say, okay, let's say 55% of people are for health care reform, what do you think it should be?
But I'm for health care reform. I just don't like anything that Obama wants.
Well, that's what I'm saying.
99% of us want health care.
Well, that's what I'm saying.
David's point is, I think, on target in that I think people like Obama. I think people want to like Obama. I think people hate his policies as a generalization. Now, there are some people who want to have the public option. There's some people who want to have cap and trade. There's some people who want these changes. But I think that's not
I don't think people hate his policies. I think people
I think the policies are out of touch.
I mean, that's from your own.
No, I don't think so.
I mean, it's always wrong for those of us who are who work in policy to think that people agree with us. They don't.
No, trust me. People don't agree with me. I understand that. But 52% of Americans don't want
but I'm saying
plan.
It's very easy to argue against any specific plan.
Yeah, it's always easier to pick apart something.
It's very easy to say, okay, here's a plan. I mean, so there was this original 1,200-page plan that came out of the House, right? The original plan.
Which everybody read.
So I go to the healthcare. Well, I go to the anti-healthcare rallies, right? People pull it out of their pockets, this thing that they have off the internet, and say, don't you know what it says on page 736, paragraph 4, sub-item C? And so, they're against the health care plan because this thing they took off the internet said that on page 731, paragraph 4. I mean, so it's very easy to.
Somebody's reading.
It's about perception, though, right? The perception is.